So first important part is that while having the conversation, um, be calm, be soothing and calm yourself. Um, for example, when we are traveling in the plane and there's turbulence, we are looking at flight attendant to see if she's panicking. That's what generates the panic. If she's calm, we are more likely to be calm. A major goal after the crisis or these tragic incidents is to restore the sense of safety. And while you're communicating, you want to tell them as well as everybody in the family that everybody is safe, and it is sad incidents, and open the communication in that way. The responses range from extreme in the form of PTSD, particularly people who are more closely linked with the tragedy, or people who are connected or know directly, or the students who went through that. Their responses would be definitely quite more extreme on the lines of PTSD. Grief is a common other reaction. Feeling the sense of loss of safety or predictability, that's a common early reaction. And the range is quite vast, similar to how we as adults feel the range. The kids have the same or even more vast range of emotional experiences to that. To the range on the other side, where some might not actually be affected by it as well. Usually, yes, age level and development level match. For example, children below 7 don't have a formed concept of death or irreversibility of it. So like cartoons, they think that person might come back, so they don't fully realize. So it's important to tune the message to them in a way that's not overly sharing. And the discussion should be child-centered, and as starting more with the questions and what do they already know, and how are they feeling about it. Because the concern many times is we adults are feeling in a certain way about it, and we think the child would feel the same way, and we have a risk of putting our fears or worries in a more magnified way. If the child is not affected, we want to communicate, but we do not need to insert our ideas. Yes, communication about these important tragedies is very important. Particularly if we bring up in a controlled way, we could control and inform in a healthier way. Nowadays with media, social media, the chances are your kid already knows about it. And when you're bringing up, it's important to just ask them and encourage communication in a healthier way. And when you're listening to their responses, listen intently for what they already know. Listen for any misinformation, any misconception, any internalized fears, and then gently correct the misinformation. And as you have brought up that important topic, also to limit the overexposure through ongoing 24/7 news channel and media coverage of that particular topic, because that overexposure does not help. Usually, sleep is an important area. Difficulty falling asleep or staying asleep, what nightmares, waking up from that. also a change in personality, or more withdrawing, isolating oneself, change in the eating habits, or for a child who was toilet trained, regresses backwards, and or child who sometimes some children become more clingy and they don't want to leave the parent at that time again, or there are other kids who start to act out more and act more defiant. Watch for and talk about it. It is common to ask questions and repeat the same questions, but if somebody is obsessing over following every single update, then that is unhealthy as well. And asking them what exactly happened, if it is, how much is it bothering them, what are they hoping, or they're thinking any new information that they're looking for, any answers, and the more they're able to talk about it versus listen to ongoing coverage. It's very important to express the feelings and how particularly around these tragedies, what is it triggering, if there are any particular emotions. Now, same thing that we do not want to provoke emotions. If somebody does not experience, that's not a worry sign either. Many teenagers, in teenage there is a concept for a certain age to feel invulnerable, and if they didn't take it in, that is they're thinking they're far away from it, it does not impact them, and that's not a danger sign. For example, if you're driving by and there's an accident on the side, if somebody does not have a strong fear reaction, does not mean anything is wrong with them. So just accept that. But if there are emotions, a healthier thing is to share with others and express and talk. That also could be a very good connecting moment for the family. It is very harmful to be overexposed, and there are studies for kids who watched 9/11 plane attacks over and over, and many young kids thought that there were several hundred planes that strike the different towers. So because they could not differentiate that the different time replaying is of the same image for the young kids, and even if the young kids are absorbed and playing with their blocks or appear fully absorbed, the story is playing in the background, they're still affected by it. They're still absorbing all of that, and in turn they start to feel that lack of distance with that incident and start to feel insecure themselves. So it is repeated exposure to those images has a chance of starting anxiety, nightmares, and it is better to control that and not follow that story, or also for their social media use to control that, and talk to them that there's no, if you have questions, come talk to us. Don't go in the social media.